our topic is on supporting young people who experience school-related anxiety. Um, I don't claim to be any particular expert sort of on this topic, but it is just an area that I work in a lot, work with a lot of young people who experience anxiety related to school and a lot of difficulties around that. But definitely don't want to be like, I'm an expert. So this is definitely just like an introduction. This is sort of what my experiences have been and my understanding of what could be helpful to talk about. Very happy for it to be interactive. So if you want to ask questions throughout, feel free to do that. Don't just have to leave them all to the end, but if you prefer, you can leave them to the end as well. But yeah, so just really briefly, a little bit about Sisu Therapies, if you're not familiar. So Sisu Therapies, we are a allied health practice here in Beenleigh, mostly made up of mental health OTs, and then we have a clinical psychologist 2 days a week as well. We have therapy dogs and cool sensory rooms and all of that sort of stuff. But yeah, our area of specialty is definitely supporting those young people where the developmental and the psychosocial stuff challenges are kind of coming together. So that's definitely our sort of area of specialty. And we're, yeah, as I said, over in Beenleigh. So the main, I suppose, learning goals of today. If you want to click to your next slide, she's already on it. So I'm trying to collaborate with multiple laptops. So understanding what anxiety is and what like school-related anxiety can be, understanding different presentations, so sort of what to look out for, what we can be aware of, what we might want to be noticing in some of our young people, and then also exploring common triggers or sort of maybe reasons why there might be anxiety at school, sort of exploring what some of those common parts are, and then as well as identifying a couple of practical strategies to support, and then time for questions at the end. Okay, so starting, what is anxiety? I just put up the American Psychological Association's definition, which is a really long one that talks about emotion is categorized by apprehension and somatic symptoms. So like symptoms within the body of tension in which individual anticipates impending danger, catastrophe, or misfortune. And so it sort of talks a little bit about there how there's a difference between anxiety and fear. So anxiety is when it's a future-oriented, long response on a threat that may or may not sort of happen, whereas fear is appropriate, sort of short-term, present, like in the moment, aka huge spider crawling on your leg. That's what I like to think of. In the moment, then that is fear, and that's sort of the difference between fear and anxiety. So school-related anxiety or anxiety around school specifically is not a diagnosis in itself. But it can be at times a symptom of another possible like anxiety disorder or another diagnosis, but it's not always. It doesn't necessarily mean that there is an underlying diagnosis there, but it can be. They're also like school-related anxiety can be known as school refusal, school avoidance, or school can't. Now, I've been looking into a little bit about school can't and school anxiety, and there seems to be that school can't is more around the idea that there is an anxiety, but it's more of a sort of a stress response. So I'm not like an expert, so I don't want to say that this is exactly the same thing when some experts might say that they're different. So I don't want to be like, it's the same when it's not, but I think there would be overlaps if we're not talking about the same thing. And then, yeah, neurodivergent children can often struggle a lot with school attendance and school-related anxiety. School can't, that's definitely a real challenge for them for a whole facet of different reasons, but they can definitely be more at risk of, I guess, having these difficulties and experiencing that. So some of the things you might notice if there's anxiety around school and school-related anxiety, so avoidance of school, so not wanting to go to school, avoidance of school-related tasks, crying or yelling or just distress when it's time for school, so it might be before school, at school drop-off, things like that. Changes in day-to-day sort of activities, so sleeping difficulties, changes in appetite, changes in their ability to do things that they maybe used to be able to sort of do okay. Something that we may not be quite aware of, but even sometimes hyperactivity or sort of silliness. before or while at school. So sometimes we'll see young people who are really like silly and crazy in the classroom, or really silly before entering into the classroom, and we might just think that, oh, they're just like being really silly, it's a behavior. But it actually can sometimes be that's their response to anxiety, like a particularly, not always, but particularly for young boys, that can sometimes come out as sort of the silliness or hyperactivity. So truancy or absence from classes. So for some of the younger ones, that can just look like they're not wanting to go into the classroom, running around the school, things like that. But sometimes even the older students will be like, as I was saying before, my husband is a high school teacher, and he'll say, he has kids who want to hide in the toilet the whole class because they are worried that they don't understand the work, and they're really stressed about it, and they're super overwhelmed and confused. So they just go hide in the toilet rather than because they're really anxious about coming to the class. You might notice signs of self-criticism. So they might be talking down about themselves, or saying like, "Oh, I did a really bad job at this," or signs of that sort of self-criticism. Feeling physically sick on school days is another really sort of common sign that we can see, especially for our younger children who are particularly unable to maybe identify what emotions they're feeling, identify what's happening in their body, identify their feelings. And so it comes out as a physical illness, or might be saying, I feel really sick in my stomach, like I can't go to school. But sometimes that feeling of feeling sick can be very similar to feeling anxious. Or it can also then that the anxiety and the stress can actually come up as physical symptoms. So headaches, sore stomachs, pain in body, all sorts of places. But that's definitely something to think about and consider. Some of the feelings of feeling worried, feeling scared, nervous, stressed, anxious, feeling irritable or feel less resilient. So feeling, they're maybe more easily irritated than they previously were, or getting frustrated by things that were never really a problem for them. And then physical symptoms of anxiety as well, like in the moment when they're feeling anxious, can look like increased heart rate, sweating, rapid breathing, shaking, things like that. Okay, so some common sort of like reasons or triggers, and again, it's difficult with this because you will say that these are some common ones, but that's not always accurate, and every young person is going to be different, and everything's going to be different for each young person. But some of the things that we've noticed, like in our practice, and what a lot of other people say are some of the things that cause or can be impacting some school-related anxiety is things like learning difficulties. So finding if they don't understand the schoolwork, or if they're having a really hard time following what's going on in the classroom. Maybe other underlying diagnoses there, like dyslexia or dysgraphia, dyscalculia, where young people are like, I just don't want to go to school, and really have a hard time going to school, because when they go to school, they don't feel successful. They find it really difficult. And that comes with a whole other range of emotions then around like, oh, I'm not meeting my peers. Maybe they're feeling embarrassed. Maybe there's a feeling of, feeling left out, or a feeling of shame or whatnot. Sensory processing differences as well. So kids who might be sensitive to sound, for example, we know if you've ever been in a school classroom, particularly primary school, it's not a quiet place. Classrooms can be very noisy and very overwhelming. So that could be part of the reason why they're not able to go to school, or really struggling to get to class or manage in the classroom environment. Also things like, uniforms and the texture of the uniform on their body, and what does that feel like? Or maybe they are a real sensory seeker and they need to be moving and running around, and maybe their classroom just expects them to be sitting still. And that can come with a whole lot of challenges as well. So yeah, sensory processing differences, it's good to sort of just think about and explore whether that might be a part of it. Social pressures. So maybe there's things going on with friends. Maybe they're struggling to make friends. Maybe there's drama going on in the friend group. Maybe there's all sorts of different things. Maybe their friendship group that they have is not really good for them, but they don't know how to sort of leave, and so they don't want it. They just avoid going to school together, so they don't have to spend time with people that they know aren't really very nice to them. And I guess kind of coming with that as well is bullying. So if they're experienced any bullying, or um, that can also, yeah, be a reason why they're not wanting to go to school. I've had a young person who was exactly that, like that part of their whole reason, and there was a real worry and a real anxiety around going to school was because they were experiencing bullying, and people didn't really know that at the time. And so once he was able to identify that that was what was going on and that was the trigger, then we can kind of go, oh, okay, right, this is what's going on. Let's do something to support that, mitigate that, hopefully stop it from happening. But at least then you can kind of understand where the stress is coming from. And like I mentioned before, there could be an underlying anxiety disorder, or other things underlying as well. Attachment or separation anxiety as well. So not always in young people, but particularly in our young, like littler ones. That's when we can see a lot of that sort of challenges with separation from parents. And that can be really hard, especially when it's maybe their first time that they've, starting school is really big change, and it can be really stressful and really difficult. So that can be part of the trigger and part of the reasons. For some of our young people as well, like family stress or difficulties at home. Sometimes when there's things going on at the home, or we're moving house or things are changing at home, that can actually impact their ability to then manage and go to school. Some of it as well could also be, I've had young people say before that, they don't want to, because there's all this stuff happening at home, they don't want to go to school because they prefer to stay home with mum and dad, because like mum or dad, because stuff's going on and I want to be there for you, sort of thing. Like it's almost a, if I leave, maybe more bad stuff will happen, or what happens if I go and then something happens and I'm not around, or that sort of thing. So there can sort of be sometimes they want to stay because there's stuff and they want to be a part of it, they want to be around, or they want to be with family when that happens. Some young people, particularly ones who are really, really high performing and put a lot of pressure on themselves, can experience, school-related anxiety around, especially if, they expect themselves to be doing really well, and then they get to a point where it's really difficult, and then the avoidance kind of starts because they don't want to do badly. They don't want to fail. They don't want to get anything less than an A. So that can lead to it a lot. I have found, again, with a lot of our young people, not always again, but particularly like our sometimes undiagnosed or later diagnosed neurodivergent girls specifically, maybe do really well through primary school. They're excelling, maybe they're school captains, like they're so great, everything's awesome. They get to high school doing okay, and then it gets to like grade 9, grade 10, grade 11, and the difficulty steps up a little bit, the pressure sort of steps up a little bit, and then they have such high expectations for themselves, and then they're either unable to go to school because they're so anxious about not doing well, or they, experience burnout, or have, lots of stress and spend all of their time doing these school tasks, which is not particularly healthy for them. So I think that's always something that I'm very mindful of when we have young people who come in who do have really high expectations for themselves and are really high performing, like just being really mindful around, okay, how can we just be preparing, especially if they're transitioning to high school soon or getting into the higher grades of primary school, how can we support you guys with this so that it doesn't end up becoming a, school anxiety or, burnout sort of issue. Executive functioning difficulties as well. So if they're having a hard time concentrating, or they're having a hard time initiating tasks, or they're having a hard time completing things and staying up to date with all of their things, that can be an impact as well. And then as well, difficulties with teachers. So if you've got a young person who really is having a hard time with their specific classroom teacher or a couple of their teachers, and again, depending on the kid, they may not feel comfortable or may not feel like it's appropriate or okay to say, my teacher's not nice, or my teacher's really mean, or my teacher, whatever, doesn't get it, or my teacher doesn't understand me, or whatever. And a lot of the time, it often is sort of just like a bit of a misunderstanding or a mismatch between the young person and the teacher, and things just aren't sort of fitting super well. But if we can realize that there is a challenge with a specific teacher or whatever, then we can kind of go from there. Um, yes. So now onto a couple of strategies. So I'm a mental health OT. That's my background. So this is my lens when it comes to particularly these strategies. So if you were to talk to maybe not a mental health OT, maybe they would have different strategies. If you were to talk to a psychologist, they might have different strategies. If you were to talk to a teacher, an educator, they would probably have different strategies. But this is just, yeah, from my perspective. So I think it's really important to start with, which I know sounds a little bit like, oh, okay, but validating the experience of the young person, I think, is really important. And especially if they're saying to you, like, if they're able to provide you with the reasons why school is tricky or why they don't want to be going to school, validating them for that and thanking them for expressing that to you is really important. And then seeking to understand why. So I think, and I talk about this a little bit later, but it's really important for us to try as best we can to approach the whole situation with curiosity and trying to understand and trying to figure out why and unpack and what's going on. Because I think what can happen sometimes is, particularly when it comes to school anxiety or school children having a really hard time at school, it can sometimes get put down to like, oh, they're just doing this because, fill in the blank. They're just XYZ because XYZ. And so I think sometimes if we can just be going, okay, well, maybe not they're just doing this because of that, but why are they doing it? What's the reason behind it? If it is that they are doing certain behaviors to get out of the classroom, why are they wanting to get out of the classroom? Like, can we dig another level deeper? Or if we're doing it so that, mum doesn't have to leave, why do we not want mum to leave? What's going on there? Like, is it an attachment thing? Are we worried? Is there stuff going on at home? Like, if we can try and just sort of get the next level down and try and understand what's going on, I think is really important. Exploring environmental factors, so both social environment, the physical environment. Is it like from a sensory point of view? Is it noisy? Is it overwhelming? Socially, are there issues going on with peers? That stuff can be important to sort of explore. And so I put in here the self-determination theory. That's probably small. If you can't read all the bits in there, that's okay, but it might be worth looking up. So aspects of the self-determination theory. So there's three sort of main parts of that. So one of them is, what's the first one that it says? Connectedness. That says competence. Competence is the first one. So these three main things are sort of the three basic psychological needs, they say, of humans. So these three things are the three psychological needs that humans need to, have a sense of a self-determination, so ability to do the things that they want to do, the things that are difficult. So the first one is, competence. That's what we said, right? But competence. So feeling a sense of that they can do the things that they need to do. So thinking back to if a child is having difficulty understanding or with learning, they're probably not feeling that sense of competence, and so they're going to have a really hard time at school. So exploring, is there anything around that sort of competence area that is a challenge for them at school? And then the next one is autonomy. So are they getting or feeling any sort of sense of, just go for it. It's all right. Autonomy. So do they have a sense of autonomy in their time? Are they getting any opportunities for choice and control in their day at all? Or is part of the anxiety is that there is no autonomy for them. They're not able to make choices. They feel that there's no sense of control for them. And so having a sense of autonomy or your ability to, have an impact on what your life and days look like, I think is really important. And I think sometimes we forget for our younger ones as well that allowing them to have that where possible and where they're able to is really, really important for them. And then the last one is connectedness. So that sort of, I guess, that social aspect. Are they feeling connected? Do they feel a sense of that they're cared for by others, or that they can care for other people? Is there a sense of social connectedness, or do they feel connected or with their class or with people at school? And so if there's not that, that can again be another thing that's impacting their ability to go to school. So sort of exploring that, looking at all that, I think can be really helpful. The next one is sensory strategies. So if there's sensory sensitivities or differences or not, I think everyone can benefit from a couple of good sensory strategies and tools. So do we need to be looking at opportunities for different sensory tools to be used, like noise cancelling headphones or fidgets or bands on the bottom of desks or whatever it is that can help them feel more regulated? Or do we need to look at what sensory strategies can be calming for them, what can be alerting for them? Do we need to be looking at, okay, if these ones particularly are calming for them and they're really heightened at the beginning of the day, can we do some of these things at home before we leave for school? Or can we do some of these things as soon as we get to school? This is what we do. We do these sorts of activities and they can help sort of calm our bodies and can be really regulating for us. And then I'll talk about this a little bit later as well, but can we do that as well throughout the day? So yeah, exploring sensory strategies I think can be really helpful. Working with the school is super, super important. And so looking at what options does the school have for supporting your young people. So does that, I said starting outside the classroom, but say I've had young people where instead of going straight to their classroom because they find that really overwhelming and stressful, maybe they meet at the, whatever is equivalent of their like growth hub or, calm space or somewhere that's calm like that. Or maybe I've had people who come to school 15 minutes late because the first 10 minutes of school is, PC class and it's really chaotic and wild and messy and they just find that really overwhelming and stressful. So they just go for their first class of the day rather than going to this sort of school meeting or whatever. Or can we have early access to our assessments? Like if there's a worry and get stressed about assessment time, can we have early access to those, or can we have those really well broken down for us? Or lots of things. I think the school will have lots of ideas as well, and they probably have things that they've offered to other students as well. But looking at what can we do to adapt, how we go to school. Can there be little things that are slightly different, or what options are there to make things change? And then I put down there psychoeducation, which just sort of means educating the family and also the young person themselves on what anxiety is, what's going on, what's happening. I found that a lot of my young people really liked and really resonated with anxiety from Inside Out too. They found that was a really helpful way for them to sort of understand what anxiety is about. Like anxiety is just trying to help, but sometimes just maybe goes about it the wrong way or kind of gets really focused on one sort of thing and is trying to give us all these worst case scenarios to prepare us, but sometimes that's not always helpful or accurate. So providing a bit of education in however old the young person is in an age appropriate way can I think be helpful so they can understand what's going on for them, why it's going on, what's actually happening. Because for young people, if they don't quite understand what's going on, it can be really, really scary, especially if you're having physical symptoms of anxiety and your heart is beating or you feel sick every day and you're like, why do I feel sick? Maybe I am sick. Like, do I need to go to the doctor? Or you're having physical symptoms, your heart's beating, you might be sweating, you might be shaking. Like that can be really scary and stressful. And again, if they're a small young person, like a young one, they may not even understand exactly what's going on, which can be super confusing. And that's just sort of adding to this whole worry and stress of what's going on. So I think giving education to the young person themselves that can be really, really helpful. And there are, I'm sure, a whole bunch of resources on that. So, if they're high school aged or 12 and up, Headspace will probably have good resources. But I'm sure lots of different places will have good resources. And if you need help finding some, I'm sure that you can help you out. So more practical strategies. This is kind of a couple here is where I get very much my OT space. So using like grading and scheduling and routines. So making sure that if we've had a really hard time at school, we haven't gone to school all week, and then we're going back to school, let's look at how we can grade that and make that achievable and doable for the young person. Um, Making sure we're grading the task so we're getting to the just right challenge. We don't want to um, so I put in there the cycle of anxiety. So it's like we have anxiety, we maybe avoid the thing that makes us anxious, we have brief sense of relief, but then the anxiety grows. And so it's a really difficult balance, I find, especially with school, when you have young people who are experiencing anxiety around school, and so then they don't go to school, and then they feel a sense of relief, but then that anxiety grows. And it's a really tricky balance between we want to not enable that anxiety sort of cycle, but we also don't want to be sending children to school when they're in fight or flight, or just going, you are in fight, flight, freeze mode. They are completely, you know, in a fear response or whatever it is. We're going, well, too bad, you have to go to school. Like, that's also not helpful. We kind of need to really strike and find a balance between giving them that just right challenge of, okay, you can go to school, you can do this, what can we do and how can we put things in place, how can we make it achievable, doable for you. Maybe you feel a little bit of anxiety, but not to the point where you are, you know flipped your lid, or there's lots of different ways to explain it, but fight, flight, freeze, you're in sort of danger zone, but just enough that then okay, I've gone to school, I was anxious, but it was actually okay, I ended up okay, and then we can kind of do that again, and it's almost like the opposite. The cycle kind of grows the opposite way. And then having a really clear routine can be helpful as well. Like, what's our morning routine look like? Can we put some routines in place before and after school so that we know what is expected? Some things that can maybe really be really helpful for them, like sensory strategies or calming strategies before or after, or finding ways to include routines can be really helpful. Exploring occupational balance, which I think is often more of a challenge in our older ones, but in our younger ones as well. But when I say occupational balance, I mean, are they doing enough things in their week, in their day, that aren't stressful or school related or productivity based or demands? Like, do they have time to do things that are fun? Do they have time? Do they have downtime? Do they have time to do things that are good for them? And um, I worked, I worked at Headspace for a couple of years, so a lot of my a chunk of time was working with some of those teenagers. And when I'd have, the 15, 16 high school age children come in who were sort of anxious about school, finding it really, really difficult, we would often sort of do a bit of okay, what are you doing with your week? And it would be, they go to school, come home from school, study till dinner, eat dinner, study after dinner, and then they go to school again. And I was like, well, no wonder you're not. No wonder you're not feeling great. Your mental health is not great, and you're finding it really stressful and overwhelming. You're having no time for self-care, no time for fun, no time for yourself, which is really, really important. And so it was about working with them. Obviously, they are studying that much because they feel the need to do that. So it would be, incorporating, how can we study smarter, not harder, like, better, shorter chunks of study, which when you're more productive, and being able to do it in that way and providing them that support rather than just study for as long as possible whenever you can every single day. Exploring sort of just emotional literacy, like, are they able to identify what they're feeling? Do they know what that is, or can they tell you? Can they use words, or do they need visuals? Can we explore, how can you tell that you're feeling anxious, or how do you know that you're having these feelings in your body? Helping them understand what it might feel like. And then introducing calming strategies, can be sensory, can be not sensory, but throughout the day, I think, is really important. So do we need to do them when we're at home before we leave? Can we do them something in the car that's fun? Or once we get to school, can we do some? Can we implement it? Even, I don't know, depending on the class and the school, there might even be opportunities for the whole class to do something. When we come back from big lunch, let's the whole class have 5 minutes of insert something that is regulating and calming, which I think a lot of the kids would benefit from. Or again, if you're with the older kids, like the high school students, I would often work with them to be like, okay, what can you do when you're lining up for your next class that you might be able to do that is kind of calming and regulating for you. Yeah. And exploring what is essential and what can be negotiated. So, if we need to be going to school, what days do we need to go to school for? What classes? What time of the day is the most important? When can we what are the essentials, what are negotiable. And then also looking at alternate school options. So there are lots of other mainstream school may just not be suitable for a young person, and that's okay. And there are a whole bunch of other schooling options available that might be worth looking at and exploring. So final just sort of tips is just approaching it with curiosity and wanting to understand, I think is really important. Trying to just go, okay, you're having this thing, and I know it can be very stressful, and especially if you are the parent and your child is the one who's anxious about going to school. It can be really hard then to just be it adds a lot of stress to the day, and it can be really frustrating and really overwhelming, I'm sure, for the day. But trying to, where we can, explore it and figure out, if we can, what's going on, what are some of the things underneath. And even though your child may not be able to just come out and say, oh well, I don't want to go to school because, and list a whole list of reasons, but if we can sort of play detective a little bit and see what we can do to find out what might be going on, and just, yeah, approaching with curiosity can be really good. Involving the young person in decision making as much as possible where possible. So if we're talking about, okay, what if we're going to school, we're making a plan of when we're going to school, what should we do when we get to school? Should we go to the classroom or should we meet here? Providing options for choice, trying to get them involved as much as possible, because again, at the end of the day, it's the young person who's experiencing the anxiety, it's the young person who's having the difficulty. So if we can be involving them in as much of the decision making, and as much of the strategies, in the discussions about what's going on, I think that's really, really important. And if I find that if the young person is involved, and a really key person involved in saying, these are the strategies that work for me, or these are the things that I want to be able to do, they're far more likely to then do it and follow through and actually be willing to try these strategies in the moment, if they're the ones that picked them, I guess, or they're the ones that said this is going to work for me. Pardon me. And I think, yeah, another really important is just using multiple support. So getting the school involved, getting therapists involved, GPs, even family members. Like, I think we can't just do it just one person. I think, you need to get a lot of people involved. I think is really important, in getting everyone behind the young person is really helpful too. And um, using multiple supports is kind of, I think, really important. So that's kind of all the main stuff. I feel like I just did a whole lot of waffling. So now I might I'll stop the recording now. And then if you have questions, feel free to